I am Dr. Selvaraj, MD, FRCP from Tuticorin, the southmost part of Tamil Nadu. I am practicing since last 40 years at Tuticorin, both cardiology and diabetes. I have served as past chairman of Tamil Nadu API and past chairman of RS Tamil Nadu, and I have conducted the Indian Society of Electrocardiology midterm conference at Tuticorin. My topic here is atrial fibrillation, antiarrhythmic drugs. Why I have chosen atrial fibrillation is the commonest arrhythmia occurring after the age of 40. As the age advances, the atrial fibrillation incidence is also increases, and most of the time atrial fibrillation is going unnoticed by the physicians and especially in ICU. Unless you carefully observe the patient continues by monitoring, you will be able to miss the diagnosis of atrial fibrillation, especially patient in ICU when they go for acute heart failure. You must search for causes like atrial fibrillation, and the rhythm or rate control, which is more important. In the early stage, rhythm control is more important in young patients. In chronic conditions, the atrial fibrillation rate control is very important. The drugs like beta blockers and the calcium channel blockers are used for the rate control, and for the rhythm control. And the people with structural heart disease, the most important drug is the amiodarone, which is commonly used both as a hemodynamically unstable patient as intravenous infusion, and people with structurally normal heart, it can be used as a oral drug for the control of rhythm. And also there are certain situations like patients with hypertrophic cardiomyopathy, and again the patients with WCP syndrome. In conditions like this, heart failure and atrial fibrillation is one of the important cause. You must be very careful to detect the atrial fibrillation. You have to treat accordingly. Thank you very much.